Now we will call upon Dr. Sujith Nayanar on Burr policing, alcohol delamination for recurrent corneal erosion.
Good afternoon, respected judges and delegates. I'll be speaking on the topic safety of my study, safety and efficacy of diamond bud polishing combined with alcohol delamination in the management of recurrent corneal erosion, a 2-year follow-up study, no financial disclosures. As you know, recurrent corneal erosion is one of the very painful and debilitating conditions that keeps recurring and remains chronic for a long time. Traumatic erosions are the most notorious cause for recurrent erosions, but other conditions like dystrophies and degenerations can also cause the same. Even though the first line of management is medical, there is no consensus regarding which is the ideal medical management for recurrent corneal erosion. Incidence of refractory cases are high, for which surgical management may be needed at some stage. Epithelial adhesion complex dysfunction, hemidesmosome dysfunction, along with some upregulated inflammatory markers like MMP and lipases are the few identified mechanisms involved in the pathophysiology in nutshell. Some unidentified causes are also there. Our study focuses on the refractory cases and its surgical management. These are the various currently performed interventions for refractory cases, among which the most popular and most commonly done worldwide technique includes alcohol delamination and the diamond bud polishing. The reported success rates for both the procedures are in the range of around 70 to 90% in most studies. We also performed these procedures. In some cases, we did it in combined because we hypothesized that these two procedures are actually acting on two various aspects of the pathophysiology. Seeing the success rate, we thought of doing this study. The purpose of the study was to look at the long-term safety and efficacy of the combined intervention involving alcohol delamination along with the diamond bud polishing for the management of refractory cases of recurrent corneal erosion. One challenge we had was the definition of the two terms, what is recurrent, what is refractory, which was not clear in any of the literature. So most literature quoted it as repeated breaks without mentioning how many times. And also for the recalcitrant, it was like insufficient conservative management with no definite criteria mentioned. So for the study, we defined recurrence as a minimum of 3 episodes since the onset, and refractory cases as defined as those who fail to get controlled even on the best and maximum tolerated medical management, or which recurs soon after the medical management is withdrawn, or a very severe or debilitating multiple recurrences. So ours was a retrospective case series of refractory cases as per the definition mentioned, in which we performed the combined alcohol delamination along with the diamond bud polishing. We excluded active and suspected viral keratitis, cicatrizal lid conditions and dry eye conditions, and also cases with limbal stem cell deficiency. We included data of only those cases which completed 2 years of follow-up. The procedure was done under topical anesthesia. The loose epithelium was debrided mechanically initially, followed by a cotton-tipped applicator. After the loose tissue was removed, a cotton-tipped applicator with alcohol, 20% alcohol, was applied to the corneal surface, which the debrided as well as the epithelialized area surrounding that area for around 2 millimeters to 4 millimeters, depending upon the case, for around 40 seconds. The loosened epithelium was later mechanically debrided. A battery operated diamond bud polish with 2 millimeter head was then used to polish the entire deepithelialized area. A bandage contact lens was then applied after thorough irrigation and applying the antibiotics. So this was the procedure. This was an unedited video. The total time was 5 minutes 47 seconds. So this is just to note that the combining the two procedures is not actually prolonging the surgery time. The Alga brush 2 with 2 millimeter head was used in all the cases. All the cases was done at the same center, same surgeon. So this was the follow-up schedule we followed. We followed the patient on the third day for removing the bandage contact lens. And the final follow-up which we took was 24 months. All the patients didn't complete all the follow-up, but we included only those patients who completed 2 years of follow-up. The primary outcome which we looked was at the recurrence of the symptomatic corneal erosion, and we also looked at safety factors like whether the BCVA was affected or any other procedure-related complications or adverse event was there. Coming to the results, total subjects included in the study was around 65 with a mean age of 35, with a predominantly female comprised of 70% of the cohort. Etiology was trauma. Etiology-wise, trauma was the main cause, comprising 80%. In 50% of cases, any particular cause could not be identified, whereas dystrophies and degenerations comprised around 4.5% of cases. Diabetes, thyroid disease, and dry eyes were the associated systemic and ocular comorbidities which we encountered. In about 14% patients, there was diabetes mellitus. The mean time to intervention was 62 months, nearly 5 years of symptoms was already there. When we looked at the recurrence rate at 2 years, which is the primary outcome, it was found to be 3.1%, which implies that the efficacy of the procedure is preventing in preventing recurrences was 97%. Those 3 cases which happened in the post-traumatic cases which had diabetes mellitus as comorbid risk factor. But it should be noted that even in those cases, the recurrence happened after 18 months in all the 3 cases, and the longer remission was attained in such cases also. While analyzing the safety aspect, we looked into the complication which happened during the period, 1 case of infectious keratitis and 1 case of stromal haze. Again, the case with the infectious keratitis happened in a patient with diabetes mellitus. Though the infectious keratitis patient had fall in BCVA, the stromal case didn't have any drop in the BCVA. Only 2 patients suffered loss in BCVA, which was one case of infectious keratitis. Second was an unrelated retinal cause for the fall in BCVA. No other patients had any fall in BCVA. So a 3% complication rate implies that that's a relatively safe procedure, and if you ignore the unrelated cause, it is only 1 case or 1.5% of complication. So 80% of patients were post-traumatic with prolonged average history of symptoms of more than 5 years, and synergy of both the techniques actually gave us a good success rate of 97% at 2 years. Just one more slide. We just did a subgroup analysis to see if we remove the diabetes, if there is any difference. When we removed the diabetes, we could find that it was almost 100% success rate. And in the diabetes patients, it was 29% failure at end of 2 years. But that too, we had almost 1.5 years of remission in such cases also. So even in such patients, it was showing very good results. And when we compared it with the literature, we showed that it actually outdone all the other studies. There were no comparative studies combining both the procedures, and there was no comparative studies between these 2 techniques, and the 97% was not mentioned in any of the studies. So to conclude, we had we didn't do a randomized study, and it was from a single center design. And there was lack of control group, but the results are very promising. We would like to continue it for looking for a 5-year results. Thank you.
Sir, as rightly mentioned, since you don't have a control group to compare these 2 parameters, but according to your experience, what made you to go for this double procedure? Because you said there are no previous studies ever done for this.
Yes.
And whether it would add cost to the procedure, or they thought that this would not be relatively effective. That's why nobody tried it previously.
Why my thought went into it, because when you look at it, the 2 mechanisms are actually working at 2 different aspects of the pathophysiology. The alcohol delamination is actually cleaning away all those unhealthy basement membrane or whatever dysfunction, hemidesmosome dysfunction and everything, is it's being cleaned away completely. Whereas the Burr polishing is giving a new surface for the new epithelium to grow. So I have been doing it for removing epithelium. I've been using alcohol in some cases, which I found that when these 2 are being done, I'm not getting any recurrences. That's when I thought whether it would be due to whether these stuff happening at 2 different levels of pathophysiology.
And the follow-up of these for how many years, sir?
2 years.
2 years.
I have included, I have more number of years in some patients, but in this study, we have included only those who have completed 2 years.
So usually the recurrence rate happens within 2 years itself. Majority of the recurrence, if it
Majority
has
of-
to happen.
Majority of the studies, all the studies are either diamond Burr polishing or for the alcohol delamination. The studies reported are for the 2 years, and the complication rate or the recurrence rate of 14%, 10%, which they have reported, is within these 2 years.
Beautiful. Thank you.
Presentation. So we once again, now the combination of both of the thing, as you see, it is actually the addition of the epithelium, which is kind of completely taken off by the burr, that is enhancing the.
Even in Dua's
Outcome.
article, who have studied the actual histopathology, they have
Huh.
concluded that there may be some unknown factors behind this, because in spite of saying all these things about trauma, we get this only in organic trauma or trauma with organic materials. So there is something else also happening other than the known pathophysiology. So this is just an observation because I've not done an histopathology of the tissue or microscopic level study. I can't.
Which we have still not, yeah. Maybe like a cadaveric eye and doing it and seeing it in the electron microscope. I'm
Yes,
just
yes,
telling, we
definitely.
will get to know why actually this is better than the other. I mean, deeper thoughts. Thank you so much.
Thank you.